Well, there's a new survey out on teen drug use, and while the results are encouraging in many ways, there's one big problem when it comes to health officials that they're trying to tackle, and that's vaping. But it's good to know that government officials are tracking the trends to help keep our kids safe and healthy. Brightside's Jenny Dean has more in the annual report from the National Institute on Drug Abuse.
Each year, 45,000 teens from 400 schools across the country fill out a survey from the National Institute on Drug Abuse.
So with that information, we're able to guide public health policy and prevention interventions.
The issue ringing the most alarm bells this year, vaping.
Vaping has been increasing in the last few years, and marijuana vaping has nearly doubled in the last year. That was quite a surprise that more teens are using marijuana in these electronic devices.
This presents several problems. First, because there's an increase in teens using marijuana because of the ease of vaping and relaxed attitudes due to various forms of legalization in many states.
We don't want teens using marijuana on a daily basis. It interferes with learning and memory. It can produce psychiatric problems in the long run, and that's a very dangerous pattern.
And the second big problem with vaping is nicotine.
We've made such good progress when it comes to reducing cigarette use by teens all across the country. We've essentially almost eliminated cigarette use by our youngest citizens. But yet, with this exposure to nicotine through vaping products, we may be undoing and undermining all that public health improvement.
Some good news, though. The abuse of alcohol, synthetic drugs, and even opioids is on a downward trend.
So that's good news in that fewer teens will be going down that pathway to opioid misuse and addiction.
So one thing parents still need to watch out for is prescriptions that you may have in your home, like Xanax and Ambien, that teens can get a hold of and abuse. So pay attention to where you keep your prescriptions and how you throw them away if there are any left over.